21% of the population experience symptoms of depression. College students are particularly vulnerable.
Cognition is just a fancy word for a thought. The realism is it doesn't cure anything. The first drug-free treatment for depression is the first step, but you need other powerful techniques. I've developed more than 100 techniques to smash these distorted negative thoughts. Recovery always happens in about 30 seconds.
Welcome to Khan Klinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing the top-rated personalities, not from only the US, but around the world. At Khan Klinics, our commitment is to bring you evidence-based information that inspires you to confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. Have you ever felt caught in a mental loop, like a broken record playing the same sad tune? Perhaps you wrestled with nagging self-doubt or found yourself jumping to conclusions that leave you feeling utterly deflated. These aren't just fleeting thoughts. They're often the insidious whispers of cognitive distortions, unhelpful and inaccurate thinking patterns. In 2022, roughly 1 in 5 adults in the United States, that's about 21% of the population, experience symptoms of depression. 18% of those struggle with anxiety within 2 weeks. But the evidence goes deeper. A 2023 study published in the Journal of Clinical Medicine found that cognitive distortions were significantly higher in individuals with panic disorders, generalized anxiety, and social anxieties. A recent Psychology Hub study found that college students are particularly vulnerable. Cognitive distortions like overgeneralization strongly predict pattern problems with memory and attention. It's clear these aren't just bad moods. It points to a critical target for intervention. The good news is that today we have one of the pioneers in this field. He's helped develop, nourish cognitive behavior therapy. He's demonstrated through decades of research and clinical practice that identifying and challenging these thought traps can be powerful antidote to the suffering overall. These thought traps are very critical importance. Stay tuned for a conversation that promises to be a roadmap to reclaiming your emotional peace and purpose. You won't want to miss this. Welcome to another illuminating episode of Khan Klinics. I'm your host, Dr. Amir Khan, and today we're joined by truly a remarkable guest who has taught millions to untwist their thinking and reclaim their emotional freedom, Dr. David Burns. He's an adjunct and clinical professor at the Emirates of Psychiatry and Behavior Sciences at Stanford University. His research involves teaching, and numerous awards, including the Bennett Award for his research on brain chemistry and the Outstanding Contribution Award from the National Association of Cognitive Behavioral Therapists. In addition, he's wrote several very popular books, including his bestseller, Feeling Good New Mode Therapy. He has sold over 4 million copies in the United States and many more worldwide. Dr. Burns received his MD from Stanford University of Medicine and completed his psychiatry residency at the University of Pennsylvania. He served as an acting chief of psychiatry at the University of Penn 1988 and a visiting scholar at Harvard University 1998. Dr. Burns, welcome to Khan Clinics.
Well, thank you. I'm so happy to be here and appreciated the beautiful introduction.
It's our pleasure, and it's really an honor having you, Dr. Burns, here. We can set off with a question then on you explaining why and what is CBT, and why is it important that we know about this therapy?
Well, CBT stands for Cognitive Behavioral Therapy, CBT. And cognition is just a fancy word for a thought. And the whole idea behind it goes back to the Greek philosopher Epictetus 2,000 years ago, who said we're disturbed not by events, but by our thoughts about them. In other words, the reality of our life does not create depression or anxiety, but it's our interpretations of what's going on. And it goes back even 500 years earlier to the Buddha, 2,500 years ago. So the idea has been around for a long time. But what's really cool is we've refined it and we've developed powerful ways to help people change the way you think and feel very quickly.
Excellent. So let's then go on to talk a little bit about TEAM-CBT, a framework as an evolution of tradition cognitive therapy. For those unfamiliar, would you explain?
Yeah, the TEAM-CBT is kind of like cognitive therapy on steroids, you might say. It's a super powerful version of it. When cognitive therapy came out in the 1970s and early 1980s, it was revolutionary. And it was the first drug-free treatment for depression that really worked and could work in a matter of, 5 or 10 or 15 sessions. But it didn't work for everybody. So I spent a lot of my career not only seeing, tens of thousands of hours I've spent with people from all around the world who were seriously depressed and anxious, but also I've done a lot of research on how therapy actually works. And one of the big keys, the reason that cognitive therapy didn't work for everybody is because a lot of people have what's called resistance. On one hand, they want to feel better, but on the other hand, they fight anyone who tries to help them. And so TEAM-CBT, in addition to powerful techniques to change the way you think and feel, also has powerful techniques to reduce and eliminate that resistance and boost motivation. And this opens the door to ultra high speed treatment and recovery. T stands for testing, and we test patients at the start and end of every session with brief, highly accurate tests that ask, how depressed are you at this moment? So we can see how much the depression changes from the start to the end of the session. This makes therapists accountable for the first time and gives the patient the message, we're going to try to do something important today to cure you, to change the way you think and feel. We're not looking for changes a month from now or 6 months from now or 2 years from now, but we want to change right now. And the testing at the start and end of the session allows us to find out if we've been successful or if we've failed. And we measure not only depression, but suicidal urges, anger, anxiety, relationship and marital problems, and even happiness with short, accurate scales. So the T is one of the most revolutionary components of this new therapy. Yeah, the E stands for empathy, and the famous Carl Rogers years ago really made empathy popular. And he said that accurate empathy, knowing how another person is feeling inside and accepting them, is the necessary and sufficient condition for emotional change. And that caught on big time, and many therapists just love this idea. But and it is important to empathize with the patient, so the patient says, you've got me, you understand me. So we've developed radical new training techniques to help therapists achieve really superior empathy, to where they can, in 25 minutes with a new patient, the patient will give them an A or an A plus on empathy. But what's also new is our research. We've done research on digital empathy delivered by a computer, as well as human empathy, and the amount of healing it produces. And the realism is it doesn't cure anything. It's nice to have someone who understands you and cares about you, but if you're depressed, or if you have an addiction, or you're having panic attacks or troubled marriage, all the empathy in the world won't help you. It's a first step, but you need other powerful techniques if you want to change the way you feel, especially if you want that to happen in today's therapy session, which I do and most of my patients do. And then the A stands for, you can call paradoxical agenda setting, or A for assessment of resistance. And after we empathize and get an A on empathy and ask the patient what they want, like if we have a miracle in today's session, what would happen? And so let's say the patient says, well, I've been depressed for 20 years. I've been to 6 psychiatrists. I've taken 12 different drugs and nothing could help me. And if a miracle happened in today's session, I'd end up the session in a state of joy, and I wouldn't be beating up on myself with all of these negative thoughts, like I'm not good enough and I'm screwed up and there must be something wrong with me and I'm defective and things will never change. And then what we do, the patient says they want that, but we make them aware that way they really don't, that there's a part of the patient that will resist therapy. And this is everybody to some extent. And it's hard to understand with depression, but it's real. But you can certainly understand it with a habit or an addiction, because if people, come, say, to the doctor and say, my wife sent me or my doctor sent me because they claim I'm drinking too much. Well, you might assume that person wants treatment for their alcoholism, but they probably don't. They love drinking, and if you're going to have any luck working with them, you have to bring that resistance to conscious awareness and have a way to eliminate it. And the same is true with depression and with anxiety. Like patients who are anxious, they're worrying constantly, but they subconsciously believe, and listeners who are anxious know this to be true, if my anxiety disappears, something terrible is going to happen. So on the one hand, they're suffering from panic attacks or phobias or public speaking anxiety. But on the other hand, they think that anxiety is protecting them or their loved ones from a calamity. For example, if you have intense public speaking anxiety, you'll refuse to give talks. If you get over it, you'll give talks and run the risk of making a fool of yourself or not doing a very, very good job. That's the type of thing. Anger, people are motivated not to let go of anger, but to act on it. And we see that in the world today, conflicts, hatred all over the world, wars breaking out. That's because of anger and the fact that people don't want love. They want anger. And so if you're going to help an angry patient or a depressed patient or a panicky patient, you want to eliminate that resistance. And we do that in the A part, the TEA. And the final M is methods. And that's the thoughts that cause your negative feelings, like I'm not good enough. Or if you're mad at someone, you say, that guy's a jerk. He's to blame for our problems. He shouldn't be the way he is. And those are all distorted thoughts also. And at the M level, if the patient still wants change, then I've developed more than 100 techniques to smash these distorted negative thoughts that trigger depression, anxiety, anger, hopelessness, shame, guilt, and so forth. And the cool thing is the very moment you stop believing those thoughts that are at the root of your suffering, in that very instant, you'll recover. People often ask me, how long does it take to recover? And I say, well, I've had over, 40,000 hours in therapy sessions with severely depressed and anxious people. Some of the most severe people in the world have come to me. But recovery always happens in about 30 seconds. It may take us a couple hours to build up to the moment when you suddenly see that your negative thoughts are not true. But the very instant you stop believing them, in that instant, you'll recover. So that's the model, and it's very exciting. Use it every day, every week. Treat many people, and it works exactly as I'm describing. And when I was a resident, finishing my residency at Penn, it was just a dream of mine that a high-speed therapy could be maybe developed, because when I treated people during my training, I never saw anyone get better. They just came and talked, and my supervisor said just encourage them to talk and give them an antidepressant. But I never saw them change. And now what we finally, it has taken, 40 years of therapy and research and innovation, and we've come up with this TEAM package, and it's very, very exciting, because now people who are suffering can hope for dramatic change, and rapid dramatic change.
That's very fascinating. And being a physician myself, I've barely heard, psychiatrist or psychologist saying, "I'm going to try to fix you within the first 2 hours of your treatment." And then you have a methodology, and it's very, very encouraging. And I hope I get this message out to the audience and those who are listening, that you could potentially be cured with your first few sessions if you're with the right person and discussing your issues with the right psychiatrist or the psychologist who's involved in your care. And TEAM-CBT sounds very fascinating. What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Klinics.